In this video, I'll be walking through generating some medical multiple choice questions live and then answering them, hopefully to give you a taste of how I'm generating the questions, whether they are of high quality, and how I walk through some of these questions, which will hopefully give you some pointers when you attempt them yourselves. I'm 1 week post finals exams, so I'm hopefully at the peak of my powers. But it's also important to note that not all the answers that the AI gives are right. And so if something looks sus, you need to, follow it up and actually do your own due diligence. So like none of these are not necessarily correct for the people watching. So this is the stem I've used. I think it's important if you are generating like complicated stems just to like experiment with this quite a bit. I'll include this in the description, but I think you can definitely tinker it to make it better. So I've just said it, asked the AI to act as a professor who writes hard multiple choice questions, included the format that I want. The example you can get from any practice exams that you have, or maybe you're, using a free online question bank like Geeky Medics or something like that. And then answers. I've gone for answers under each question, but you could put answers at the very end. To be honest, it probably works better if the answers are at the very end. But for the sake of this video, I think it'll work better if the answers are under the question. I'm using Perplexity Pro just because I find this to be the best. It's free for students, so if you want to, check out Perplexity Pro and comment, make sure you check out the link in the description. I'll also have this stem. All right, so. Now, the trick is when the answers are below, I've just got to try not to scroll too far just to reveal the answers. So we have a 72-year-old woman with sudden onset left weakness and slurred speech. So you're thinking of stroke here. History of AF and hypertension. She has a facial droop, and so everything is looking like an ischemic stroke. Obviously, you can't really tell without if it's a bleed without the CT, but that's normal. So in terms of things I would be doing, this is quite an urgent situation. It's a sudden onset stroke. So in this case, you probably wouldn't be, doing other investigations. You probably want to do some sort of management. So it wouldn't be B, D. I think dual antiplatelets. Uh, I think it's just aspirin in the first 24 hours. I'm not sure when you would actually start the clopidogrel. So that's something I would just research on the side there because, just going through it, I don't know. I'm pretty confident it's aspirin within the first 24 hours for ischemic, but I don't know when clopidogrel would be started. I don't think you use ivory heparin, so I'd be thrombolizing. All right, so in this case, they've gone for B repeat CT scan, and they have their explanation. I did look through this question before, and I was a bit confused. So then I think if you get answers like that, just copy the question and just check it on a different AI. And if they all say the same thing, then you might be onto something. But also just look at some proper guidelines here. But for the sake of efficiency, given that this one has co-pilots coming with a different answer, this is probably not reliable. So it's something to check. But I've also got the learning point of I need to now look at the timing of clopidogrel in stroke. 54-year-old man presents with severe chest pain radiating to the back, hypertensive with ECG changes. So it is a classic story for aortic dissection. So you have this chest pain radiating to the back. You have the cardiac parameters with the ECG changes. The troponins are elevated. And then you have this thickening of the descending aortic wall. Now, descending aortic dissections are managed medically with blood pressure management. So this is going to be IV labetalol. The surgical repair is more, I think, for ascending. Again, I could be wrong with all of these things, but this is just what I think. And that's what the explanation is saying. Now, I'm just going to avoid trying to look at the titles and have a look at the options. Normally, the diagnosis is actually like not too hard to get. For example, our rods are only present in AML. And so this fatigue, easy bruising, recurrent gum infections, it's a sort of classic story for leukemia, a blood-borne cancer. And the blast with our rod suggests that this is AML. Now, which chromosomal abnormality is this? I have next to no idea. I know 922 is the Philadelphia chromosome for CML. I think this is 1517, I think is APML, but there's no DIC, and I think the film would show different findings in APML, which is a subset of AML. That leaves me with three things of which I have no idea. Okay, so the answer is B. Um, Now this is an easy one to. Oh wait, here's APML. Ah, well, that's the one I thought of that and I didn't think the story fit. Interesting. Maybe the others are just like completely unrelated. That's something for me to do some research on, and I just add that to the Anki. Again, this is pretty hard, but fair play. So we have a 68-year-old man, COPD, increasing dyspnea and confusion on home oxygen. So that suggests that it's pretty late stage. ABG shows this is acidosis with a high CO2, which you'd sort of expect. O2 is low. I think that's pretty high for bicarb. So that suggests a chronic respiratory acidosis with, I guess, partial compensation. All right, so what would you do? What would you do? So he's confused, breathlessness, low oxygen. Um, what would you do here? So COPD, like the CO2 is generally quite high. So I'd be thinking, I normally think of like things in quite a simplistic way, not the proper explanation, but I think, use CPAP when the oxygen's low, um, like only when the oxygen's low and the CO2 is sort of normal. So that's like OSA. And then if you want to manage the oxygen and the CO2, then you do the BiPAP. So I would think about BiPAP here, just because I think we want to get the CO2 down. Furosemide would be for APO, so that's probably not right. This is probably going to be problematic. Um, I don't think he needs to be intubated. I think B sounds reasonable. Okay, and that's right. Painless swelling in the right testis. I mean, hypoechoic mass without. So yeah, this is going to be a testicular cancer, I think. Well, could be anything really, but without calcifications or cystic areas. Oh, that's actually tricky. Okay, so I think you can classify testicular cancers as seminoma and non-seminoma. Actually, that's probably not even right. It's like germ cell and non-germ cell. That's another point for me to research. In any case, if I think it's I'm mixing this up. Anyway, so the teratoma, so I just remember techie. So teratoma, embryonal carcinoma, choreo, and yolk sac. These are all non-seminomatous, and you would expect like they're more likely to have some of these things: calcification, cysts, elevated AFP, ACG. So if all that's normal, I think seminoma, and I think it's more common as well. Okay, so that's another one. Weight loss, palpitations, and tremor. So this is hyperthyroidism. Diffusely enlarged thyroid, lewd leg, and myxedemia. Now she has a sore throat and fever. So yeah, like for each drug, you don't need to know every single side effect, right? You just need to know like the main side effects. So hyperthyroidism, given an antithyroid drug, probably carbimazole, and that causes agranulocytosis, which generally presents with the sore throat and fever. So I'm worried about agranulocytosis here. Um, so that's probably the most serious thing. It's probably going to be A. Would you continue? Probably not. I think you just A. And I think antibiotics are probably important here as well. All right, male athlete, recurrent knee pain and swelling, yellow fluid. This white cell count is not high enough to be septic arthritis, I don't think. Or not high enough to be like strongly suggestive, but I think the crystals sort of give it away. Uh, Geez Louise. Now, I have no idea what three of these things are. Glucose 6 phosphatase, I know from G6PD deficiency, and xanthine oxidase, I know because allopurinol is a xanthine oxidase inhibitor. So, if you are deficient in xanthine oxidase, why would you need to inhibit it? Okay, so the two I know, B and D, I don't think are right. Um, let's just go with this because it has xanthine in it. We'll see. All right. So it's a bit lucky, obviously, but I don't know. To me, when I'm doing this question, this is too specific. This is too niche for me to care too much about. So I probably wouldn't Anki this. But like the ones where you guess and still get it right, I think they're still worth Ankiing. But I might rephrase it. So rather than just copying and pasting the question, I might say like, enzyme deficiency involved in gout, and then I have to think about it de novo. All right. Question 8 out of 10. Third trimester seizure, high blood pressure, proteinuria, reflexes up risk. So this is eclampsia. Most important treatment step is probably magnesium sulfate. So that's just like a classic one. Uh, Fatigue, anemia, rule low. So you get that in multiple myeloma. So this is some of the crab features, I believe. Um, all right. So disease severity. So the crab features are hypercalcemia, so C for calcium, R for renal impairment, A for anemia, and I think B is bone or back pain. So best indicate disease severity. So this is our anemia. This is our calcium. I don't think haptoglobin's relevant. B2 microglobulin. I have no idea. Again, my guess is I would think like how much the bone marrow is filled up is probably one thing. Another would be E, but I don't know. So I would guess probably B. Um, Fair enough. So that's an important one. I think that's an important one for my learning. So I'd put that on the Anki. Simply just, copy and paste that front of the card and then copy and paste that back of the card and then you're all done. All right. Recurrent infections, failure to thrive, steatorrhea, and positive sweat chloride is CF. He has a gene mutation causing a defective. Yeah, I'm not going to get this. Yeah, so this one I've got no idea. So the gene mutation causes defective chloride channel folding. So it's probably not production. It's probably something to do with folding. Um, so I'm going to avoid production and synthesis. Conductance, channel opening. I'm just going to say B. I've got no idea. Okay, bit lucky. So another thing you'll note is I think all of these were none of them were like, what's the diagnosis? They were all about management and a bit about pathophys. Actually, there's one here about diagnosis. So what I could have done, which to make this a bit better, is I only included one example, which was a diagnosis question. So I could have included an example of a diagnosis question, an investigation question, and a management question, and asked it to come up with equal parts of those. These are pretty hard questions. They're a bit too specific though. So I can then just instruct the AI to just give me some feedback based on that. But hopefully this was helpful just to show you how I'm generating the questions with AI and some of my thought process going through the questions. They were pretty hard, so if you got all of them right, you're a superstar. And yeah, just again, like anything on the AI, you need to just check to see if that's actually right with some reputable guidelines, or just follow the links and or ask for some references as to where they got that information. Again, for Perplexity Pro, click the link in the description, and I'll include the prompt that I used for the AI in the description as well. Thanks very much, guys.